Liposuction costs really vary a lot, okay? And that's just in my cases from patient to patient and also from doctor to doctor. If I have a small patient and I have a larger patient, the small patient where I have this much fat is going to cost a lot less than the larger patient where I have this much fat to remove. That's going to be the case with most doctors. They're going to price things according to how much work they're going to have to do. Every doctor does liposuction to a different extent. Whereas the average surgeon removes only about 50%, there are some surgeons that only remove 30%. You don't see much of a difference. And then there's some surgeons who are very aggressive that may remove 80 to 90%. And that's not going to be your typical surgeon. That is one reason why my costs are more expensive than others. That doing an 80 to 90% removal is going to take almost twice as much time. When it comes to liposuction, there's completeness, there's smoothness, getting it real smooth versus lumpy and bumpy, and there is just the quality of the results. How beautiful is the shape that the doctor created? As an artist, which I've already talked about earlier, I'm looking for a beautiful shape that is very complete, very smooth, and creates a shape on your body that really enhances things. When I do the waist, I'm not just doing this little section. I'm doing this, I'm going up into the mid-back, I'm going down to the hip. I'm actually creating a very continuous hourglass curve that's going to enhance your breast, it's going to enhance your bottom. Not all doctors think like this. So what their waist cost may be very different from my waist cost, which is actually a lot more complete here to here. Probably the easiest way to compare other doctors to what you see with me is just look at the work. I show more results than anybody, and I'm very proud of the work that I do. So you don't want to base your decision on price alone. If you did, it will cost you much more in the end. In my day-to-day practice, I probably am doing corrections on 20 to 30% of the patients that I see. Every single day, I'm seeing more in consultation that walk in and they've already had liposuction in the area that we're looking at. And you really have to, consider these things before picking a doctor because they're cheaper. So that's about all I can say. And if you really want an exact cost, we can always do that, but it requires coming in for consultation because everybody's body and body areas are different.